Hi guys, it's Dr. Sandra Lee here. You also know me as Dr. Pimple Popper, and I'm here to answer all your questions about acne. Acne is caused by, in general, hormones and genetics. It's really what kind of skin that your parents have passed on to you. It tends to get worse during those times where we're very hormonal, such as puberty or such as that certain time of the month. I think that different kinds of foods can potentially cause acne if they have hormones in it, such as milk. It's a fallacy a little bit that people tend to say, don't eat that greasy food because it's just gonna cause you to break out. You know, when we eat greasy food, we don't actually feel our skin get really greasy, so that should tell you something. Essentially, acne is acne. We tend to get pimples in the same general area because there's usually more oil there. For example, there is pomade acne. That is when people wear a lot of hair products on their face and maybe they brush their hair across their face. We'll see a lot of blackheads and whiteheads under there because it's under occlusion and maybe there's oil. And I have a recurrent one. Actually, I've been fighting for the last 2 months on my chin. I myself have that. It's hard for me because then I have to say, oh my gosh, what's going on with me? I think all these pimples are trying to come back and get me, actually. You shouldn't pop a pimple at all, but I know many people are gonna do it. So I think that the best advice I can give you is to make sure it is the most superficial on your skin, because the more superficial you traumatize your skin, the less risk you have for infection and permanent scarring, and that's what we really want to avoid. If you have that deep-seated bump, no matter where it is on your body, and you squeeze that, you know it's only gonna get bigger and madder at you and more painful. You wanna apply warm compresses to an area and try to be patient. So you're waiting for your body to push it out to the surface, and then you're doing that last little bit to say, release, like open the doors and say, get out of here. Sometimes you're popping something, you think it's a pimple, but it's not. So I suggest having a timer or something, something that gives you 20 seconds, 30 seconds, but then stop, because if you keep pushing on something that doesn't want to pop, you're probably gonna cause problems. There are a lot of products out there that you can use to treat acne, and I think it's really overwhelming for people. They go to the cosmetic counter and they don't know what to use. And that's why I actually created my own line, SLMD Skincare, because it really is the products that I would use, I would recommend as a dermatologist to my patients. The one thing I want people to know about acne is if you want it treated, you can find a good treatment. You can find something that will help you. It just depends on the type of acne you have and seeing a good board-certified dermatologist who really has all the options in front of them. I hope I answered all your questions about acne. Thank you guys for listening and having me around, and thank you for loving pimple popping. Popaholics Unite!